Okay, so let's get into chapter 11. This is going to be part 1 of a 2-part lecture. So we give medications, we've talked about that, and we're going to talk about the specific medications, but let's understand why. The term pharmacology means the science of the drugs. It's understanding why you give a drug, when you give a drug, how you give a drug. We give medication to prevent or treat disease and to relieve pain. So we're going to give it based on the need, based on the criteria, based on the person. We then also need to understand pharmacodynamics. And that means that we need to understand how it is the drugs are going to be processed and interact in the body. A few key terms for you. The first is agonist. An agonist is something that causes the receptors in the body to react. It stimulates them. The opposite being an antagonist. The antagonist is going to bind to the receptors and block other medications or chemicals, prevent them from functioning. We're going to know dose. So dose is something we're going to talk about, and that's the amount of the medication given, which is going to be dependent on weight, age, the action you desire within the patient, a whole bunch of things. But for the most part, our dose doesn't change. So, how medications work? Well, we're looking for them to have an action, that therapeutic effect, the reason why we give it. An indication is why we give it. What is the reason that they need to have the drug? Are they having chest pain? Then they need to have nitro. Are they having difficulty breathing? Then that's the indication to give them oxygen. We need to worry about contraindications, which are a harmful effect that may happen. So we'll learn about nitro. If they've taken an erectile dysfunction drug, it can actually be a contraindication. And then we need to understand the side effects, those things that we can expect to happen when I give the patient the drug. Some may be negative and some may just be a sign that the drug's actually working. So if I give the EpiPen, I'm going to expect the heart rate to increase. It's a side effect, but it's not necessarily a negative one. Understand you should probably start becoming familiar with the generic and the trade name of the medications. So the generic name is the simple, clear, non-proprietary name. So you probably think of ibuprofen, aspirin, that type of stuff. Meanwhile, the trade name is that manufacturer's name. It's what it's sold as in the commercials. This is Tylenol, Aleve, Advil. We give a bunch of different types of drugs in the field, but more importantly, your patient's going to take a bunch of different types of drugs at home. When you ask about medications in your assessment, you need to know about all of them. Everything that's on the screen right now has the potential to impact the drugs you give, they impact the patient, they may impact your assessment of the patient. So it's important that the patient understand why you need to know everything. So let's talk about the routes of administration of a medication. Sometimes we need to consider how it is that the medication is going to enter the patient, because that's going to impact exactly what we're able to do for our patient and how it works for our patient. So one route that we'll do is enteral medications. So the enteral medications are the ones that you are going to take by mouth through the digestive system. And then the parenteral medications are the ones that enter the body by some other means. Know that you're going to need to understand that the absorption of the medication is going to impact how quickly it gets into the patient's system. We do commonly give oral medication by mouth or PO. You will less likely give by rectum, though especially in your seizure patients, they may have at-home medication administration because that is a mucous membrane and does allow for quick absorption, especially if your patient is not able to take their medication by mouth. But like I said, that is not really an administration we see as EMS providers in the field. So how do we get medication into the body? Commonly, we are going to go intravenous, IV. Well, not us. Intravenous, interosseous, and subcutaneous are going to be your ALS providers, but you need to understand how it's done. You need to be able to support them and recognize some of the side effects that these drugs may have. We do give an intramuscular medication, and we'll talk about that later. Inhalation is a drug that's inhaled into the lungs. Sublingual means under the tongue. Transdermal or transcutaneous through the skin. So those are your nicotine patches, your birth control patches, your nitro patches or paste. And then intranasal. So intranasal is introduced through the nose through a device that's going to aerosolize the drug. And this is, again, table 11-1. It's just a picture of stuff and gives you a reminder about how the absorption happens based on the administration route. As you can see, your intravenous and your interosseous, you get immediate absorption. So these are going to be your top methods for administration of medication, especially in emergency situations. Along with administration, you have to understand the form of the medication. And how the medication comes delivered is going to impact how the medication is delivered to the patient. So if it's a tablet, if it's an aerosolized drug, obviously it's going to impact how you can give it to the patient. The basic forms that we're going to see, you're going to see tablets or capsules, solutions and suspensions. We don't like those as much because they do take some mixing or some extra work in the field. A metered dose inhaler, MDI, that's the one that's going to give you the same medication every time you squeeze it. Topical medication is going to go on the skin. Transcutaneous medications, they're going to be put on the skin. They may be a patch or just some type of cream. You have gels and then gases for inhalation. So your solutions and suspensions are going to be a liquid mixture, which in the back of a moving truck, not always fun to have to deal with. Most of the time, these are going to be given IM, IV, or subcutaneous injection. And a suspension is something that doesn't dissolve well in liquids. It separates if it stands or is filtered. So you end up having to make sure that you shake these well. We do sometimes carry activated charcoal in the suspension form. This is a picture of the metered dose inhaler. Y'all are probably all familiar with it if you're an asthmatic or if you know an asthmatic. This is delivered through inhalation, and every time you push that canister down, you're getting the same amount of medication. Topical medications, lotions, creams, ointments. We give this on top of the skin. It only impacts the area that it's touching. And you can see some of the great examples on here, such as calamine lotion, hydrocortisone cream, Neosporin. Transcutaneous medications are going to be absorbed into the skin to be able to enter the bloodstream. So they're going to have a systemic effect. They're going to impact more than just the area of application. Here's an example of a patch. It almost looks like a Band-Aid. So you do have to be cautious about this in some situations. You have to use caution because some of these medications, if you touch them with bare skin, it's actually going to have an impact on you as well. It's not only absorbing into the patient, it absorbs into any skin that comes in contact with it. You've got your gels, which are your semi-liquid. They're a little thicker. For us, we use the oral glucose gel for delivery of oral glucose to our diabetic patients. And then, of course, you've got your gases for inhalation. Our most common is going to be oxygen. You do have some agencies in other states that are using nitrous oxide for pain management, and so that's one you may contend with. So some general considerations. We use standing protocols, and we use medical control for the delivery of medication. You should not be giving medication that is not covered in your standard protocols, that is not within your scope of practice. You shouldn't be giving IV drugs. There should not be any use of an IO drilling into the bone to deliver medications. That is well outside of your scope of practice. Those of you who become paramedics, you're going to increase the ways that you can administer drugs. We're going to follow the 6 rights of medication administration, because when you don't follow those rights, you will most likely have a medical error and medication error. And here they are. When we talk about the 6 rights, we're talking about the right patient, as in you're giving the drug to the person who needs it, to the person who's supposed to get it. We're going to talk about the right medication. So every time I give a drug, I'm going to verify that it's the right medication for the problem my patient's having. I'm not going to give aspirin for difficulty breathing. I'm not going to give glucose to a stroke patient. I'm going to give the right dose, both based on protocol and based on medical control. I need to give my patient the appropriate amount of medication. I'm going to give it the right route. So if it's inhaled, they're going to inhale it. If it's ingested, it should go in their mouth. I can't, for good conscience, mix that up. I can't deliver a medication a different route than it's supposed to be. I'm going to give the medication at the right time. Big thing here is, have you finished your appropriate assessment? Star this note, write it down, highlight it, circle it. Do not give a medication if you have not taken a set of vitals. If you give a medication before getting vital signs, except for maybe oxygen, but if you give any other medication before you've gotten to the vital signs and completed a set of vital signs, you're going to fail. You're going to fail the state test. You're going to fail your patient. You'll just fail. And then you want to have the right documentation, writing down everything that is appropriate about why, when, and how you delivered that medication to the patient.